I want to thank you for clicking through and following me on this new journey. As I mentioned before, I'm Dr. Richard Busch, and in 1996, 27 years ago, we started a prepaid case fee practice from scratch. Now, what does that mean? Well, that means that we work on a cash basis with our patients. I've never actually been enrolled in any type of an insurance company or any type of an insurance plan. I'm non-participating with Medicare, and we've never actually signed up with any insurance company in any way, shape, or form. Now, the reason that's important is because as far as treatment is concerned, we want to make sure that we're actually in control over what type of care we offer the patient, what type of an outcome they're going to get. They're going to actually get a better outcome with what we do. But it's very important to understand that to have success in this type of a practice, we have to make sure that there aren't any gimmicks, okay? This isn't a situation where there's a hard sell that can ever work, because the more you put pressure on a patient to take this type of a treatment program, the more you're going to push them away. It's almost like using a magnet to repel them, okay? So the interesting thing about this is when we work with patients, we want to make sure that we educate those patients and explain to them exactly what the problem is and exactly what the situation is, so that we give them the proper idea so that they can make the decision for what it is that they want. People love to buy, but they hate to be sold to, or they hate to be sold. And as far as that's concerned, I think that in our profession, unfortunately, over the course of many years, people have actually used that hard sell really to our detriment. So we want to make sure that we're not using any gimmicks. We want to make sure that we're educating the patient properly. We want to make sure that as far as all of this stuff goes, that we're giving the patient all the control over what they need to make the right decision. And that's the first secret to this program. The second secret to this program is to actually make sure that we have a plan. Make sure that our staff are trained properly. You know, the interesting thing about this is if your staff isn't trained properly, it doesn't matter how many patients call your office. They're not going to want to make an appointment, or they're not going to want to come and spend any money with you because, frankly, they're not handling the patient or managing the patient's care correctly. And along with that, the doctor has to make sure that he has a plan for what's going on. We need to make sure that we've got a plan for how to handle and manage each and every aspect of these patients' care. And the biggest thing when we're working with patients on a cash basis, you have to have a great deal of success. You know, my focus in practice is making sure that we get as many people well as we possibly can, and we get the best possible results. You can't practice the way that I have for the last 27 years if you don't have a great deal of success in working with your patients and a great outcome with that. And the patients can feel it if that's not what your focus is. So we have to make sure that we understand that, and that's something that we have that's kind of part of the second secret to this. Again, we need to manage patients' outcomes, and the interesting thing about working the way that I do is as soon as a patient decides to take care, they actually begin to get better. And so again, we get better outcomes with what we're doing. But then along with that, we start to look at things like marketing. And you know, if you look at Facebook or really anything anymore, pretty much everybody out there is now a Facebook guru, right? You know, you see these ads, I can bring as many people as you could ever imagine to your office. I can flood your office with new patients. We can get you 30, 60, 90, 100 new patients a month. First of all, how many of those patients can you actually process in your office? Or process efficiently, I should say. But along with that, how many of those patients are actually good quality patients? How many of them are tire kickers? How many are just looking around, just trying to figure out what it is that you're trying to do, or what it is that you're doing, but really don't necessarily want to get well? You know, we've done all types of advertising and marketing over the course of the last 27 years in my office. We've used radio, we've used TV, we've used tabloids, and I do currently use Facebook as well, and also some of the PPC campaigns. The thing about it is, there are different types of patients in each of those mediums, and so we have to make sure that we understand that when we begin marketing. Okay, what type of patient is it that you want? Because I can flood your office with the wrong types of patients if I want. But along with that, I want the type of patient that actually knows that they have a problem, is willing to invest in that problem, and wants to get well. Because we get better outcomes with those patients, and our outcomes are all that I really care about. As far as treatment is concerned, one of the ideas here is we want to make sure that we have all that. And so when we're dealing with all these things and we're talking about marketing, we want to make sure that if we're working with people with Facebook, that we're working with the right people that actually know what's going on, and we work with those people. As we start to get doctors involved in something called the Cash Master Practice, which is what we're actually talking about here today, the whole purpose behind this is we want to make sure that we train as many doctors as we can to get as good of possible results as they possibly can, whether it's with the patients and the patient's outcomes. But along with that, we want to make sure that they get a great result, not only with the patient, but also financially as well. so they can continue to support and have the type of life that they want. 15 years ago, we started a program where we started training both medical doctors and chiropractors to do what we do in my office. It was called Freedom Awaits, and shortly thereafter became the Busch All Cash Academy. So we've trained medical doctors and chiropractors to be very successful in implementing this program into their office. Now, what we've done here recently is we've actually kind of moved this program so that it's more online. So this is more of an online training portal for you, if you will. That's what Cash Master Practice is. The Cash Master Practice is a program that can be molded into any type of practice that you want. Again, whether it's chiropractic, whether it's medical, whether it's spinal decompression or neuropathy, knees, carpal tunnel, nutrition, you name it, this program will actually fit into it and work in it very, very effectively, efficiently, and nicely. So if you're interested, please make sure you check out cashmasterpractice.com. Click the link below and fill out your information, and let's set up a time where we can actually sit down and talk about your situation, what's going to be best for you, and we're going to find out whether you're going to be a good fit with us. We're not accepting every doctor for this program. Okay, so we're actually kind of screening doctors just like we're screening patients. So if you're interested in actually changing your life in a beneficial manner to be able to be, do, and have more and all the things that you want in life, and be able to have that million or multi-million-dollar practice, we do have the information that you need. If you're interested in learning how to do this, then please fill out the link below, fill your information in, or if you have any questions along the way, please make sure you email me either at drbush@cashmasterpractice.com or drbush@bushchiropractic.com. And the idea behind all of this is we want to have the best possible outcomes we can have for the doctors and for the patients. So fill out your information below. And if you have any questions, please make sure, let's sit down and talk so we can find out whether you're a good fit for us and we're a good fit for you. Thank you very much for your time.